So we come to the torsion of the testes, as I've already said. Basically, remember the spermatic cord. So if it twists around itself, then you end up with necrosis. So that's necrosis of tissue with extensive congestion and hemorrhage due to venous infarction. So the veins are blocked. So you end up with infarction because eventually even the arteries bringing blood will also be blocked because of the twisting around itself. Yeah, in the spermatic cord. That's what we call testicular torsion or torsion of the testis. So spermatic cord is liable to twist, leading to compression of the thin-walled veins. So the veins there are thin-walled and obstruction of venous drainage from the testis. So this is an important cause of testicular pain in childhood and young adulthood, especially if you look at children, maybe boys who are in high school. It's quite common, and in primary school, and even in childhood. So in fact, recently the urologists, those are the doctors who deal with bladder, testes, penis, all that area, they really were trying to sensitize the community that they have a lot of loss of testes because a boy in school develop pain, he's told he's pretending, he's not being taken to hospital. By the time they reach to hospital, the testis is already dead and you just have to remove it. So young children, young boys, when they complain of testicular pain, it is important that we rush them to hospital as soon as possible. Because usually the time span you have to save a testis, if it was not complete when they have torsion, usually 6 to 8 hours. So if somebody develops a sudden pain, testicular pain, a young boy or a young man, then they need to be rushed to the hospital as soon as possible so that as to save those testes from infarction.